Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. I've got a free 31-page PDF on the top 200 drugs. It's a great study guide if you're taking any type of board exam, or if you're in pharmacology classes, going through that in college. Great resource, great refresher if you're out in practice as well. So again, free, totally free, simply for subscribing to the podcast by sharing your email there. So with that said, let's get into the drug of the day today, and that is ethinyl estradiol. And I wanted to break these apart a little bit because ethinyl estradiol is part of combined oral contraceptives with a progesterone component. Obviously, ethinyl estradiol is the estrogen type component. Brand names of those combination oral contraceptives include Sprintec, Jolessa, Apri, Levora, Cariva, Notrel, Yaz. So there's tons and tons of brand name oral contraceptives, and each one tends to either have a different dosage of ethinyl estradiol and or a different progesterone component. So that's really what the difference is. So you've got to kind of look at each individual label, each individual brand name. And I will say our friends at pearls.com have a wonderful resource with all the brand names, and I certainly didn't list them all in the podcast here. So to do that, you can go check out pearls.com/RLP, like reallifepharmacology.com. Simply creating a free account there, you'll get access to their layout, their PDF of all the different birth control options, brand names, and what the different strength and dosage forms are there. So a great resource. I used it to help kind of put this together a little bit as well. So let's get into mechanism of action a little bit. Estrogen, so ethinyl estradiol, is basically estrogen. It's a synthetic estrogen. And in the body, estrogen has negative feedback on the pituitary gland. So that negative feedback basically causes a reduction in FSH secretion. And FSH is follicle stimulating hormone. Ultimately, this inhibits follicular development and ultimately ovulation and helps prevent pregnancy. Now, I will note that generally the progesterone component is considered to do a little bit more of that prevention of pregnancy than estrogen or ethinyl estradiol, but certainly that plays a role there as well. Let's talk dosing a little bit. I think that's a really important thing and definitely something that I have come across as far as having questions and things like that. So what's the difference? Why do we use maybe a very low dose like 10 micrograms versus a higher dose like 50 micrograms? Is it more effective? And so on and so forth. What's the deal there? So first I'll mention that standard preparations, probably the most common you're going to see in practice, are in the 20 to 30 microgram range, maybe up to 35 microgram range. So that is where, I think most clinicians are prescribing things. So the biggest thing, the biggest adverse effect that you need to pay attention to and why the estrogen component or the ethinyl estradiol component matters is breakthrough bleeding. So generally, the lower the dose of that ethinyl estradiol, the more and more likely it might occur that a patient has breakthrough bleeding. And reminder, breakthrough bleeding, a small amount of blood when we're not anticipating the period. So that's probably the biggest reason why we're worried about the dose, because efficacy has been proven to be fairly similar. And again, that efficacy depends upon the progesterone component as well. So, if you thought that, hey, efficacy in preventing pregnancy is close, why wouldn't we 100% minimize the ethinyl estradiol component? And that reason is likely breakthrough bleeding. There is potential for other adverse effects as well as we escalate the dose of ethinyl estradiol. I believe initially when oral contraceptives were creative, there were dosages upwards of 50, 100 micrograms plus that were utilized of ethinyl estradiol. And patients tended to encounter a lot more GI upset, like nausea and that type of thing. So that can occur for some patients for sure. Headaches have certainly been reported. So that bleeding, heavy menses, breakthrough bleeding, that can occur potentially as we have lower dosages, or maybe a little bit more likely with lower dosages. And then, of course, anytime you talk about estrogen, we have got to talk about blood clot risk. Okay, so the risk for DVT, PE, stroke, things like that. And there are specific contraindications to oral contraceptives, which obviously includes ethinyl estradiol. This is a classic board exam question where you're given a patient case and they have a history of DVT, PE, or another contraindication, and you've got to recognize that and say, hey, we can't use combined oral contraceptives or a drug like ethinyl estradiol here. So contraindications, so history, DVT, PE, active liver disease, high cardiovascular risk, smoking, and age greater than or equal to 35. So that's a risk factor as well there for an increased clot risk, uncontrolled hypertension, also breast cancer. So we can have some risks there with ethinyl estradiol as well. And there are some more. I'm not going to go through every single one on the list. Those are some really, really big ones that at least I have found tested on throughout pharmacology classes and board exams that I laid out there. But the CDC has a summary chart of U.S. medical eligibility criteria for contraceptive use. Okay, so if you Google search CDC summary chart of contraceptive use, you'll probably find it there. But the full title is Summary Chart of U.S. Medical Eligibility Criteria for Contraceptive Use. So yeah, CDC's got that nice chart, and it kind of lays out a whole bunch of different medical conditions and, kind of what's the risk of using contraceptives in these types of patients, or these types of disease states that patients might have. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, NAPLEX, go check out meded101.com/store, S-T-O-R-E. We've got a growing list of resources there that can absolutely help prepare you to pass your exam. And we've got a growing list of testimonials as well, with thousands of customers who have checked out our study materials. So go check that out. Support the sponsor, meded101.com/store, S-T-O-R-E. There's also links for other healthcare professionals and pharmacists alike. Go check that out at meded101.com/store as well. Got a new book on nursing pharmacology, food medication interactions, drug interactions, case studies, all sorts of different resources for any healthcare professional that works with medications. So go check out all those links, meded101.com/store, S-T-O-R-E. All right, let's wrap up with drug interactions. With oral contraceptives, I wouldn't say there's a ton of drug interactions. CYP3A4 inducers are a significant deal. Okay, so that's your carbamazepine, your St. John's wort, your rifampin, maybe phenytoin. These can all potentially reduce concentrations of ethinyl estradiol. Okay, and by doing that, obviously, we could run the risk of breakthrough bleeding, and potentially, at least in theory, if concentrations of ethinyl estradiol got low enough and or the progesterone component got low enough, we could potentially have an unintended pregnancy as well. So really, really important to remember those enzyme inducers and keep those in the back of your mind, and maybe double check, run a drug interaction screen if you know a patient that has to have one of these enzyme inducers. Topiramate, I did want to mention, while not classically considered maybe an enzyme inducer, at least to the extent of some of those other meds I listed, there is some potential evidence, particularly at higher dosages, where there have been reports of unintended pregnancies and or breakthrough bleeding. And again, particularly at higher doses of topiramate, and then using it with ethinyl estradiol as a component of oral contraceptions. And then one last one I wanted to mention was ethinyl estradiol in combo with progestins have been reported to reduce lamotrigine levels. Okay, so if you got a stable bipolar patient on lamotrigine, certainly we wouldn't want to start a drug like ethinyl estradiol in combo with a progestin and reduce those levels and potentially alter the stability of the patient with psychiatric illness. So that can be a little bit of a challenge there. But just a good thing to remember, there's a lot of seizure medications or anti-epileptic medications that can interact with ethinyl estradiol. Okay, so that's a good way to think about it. But there are others as well, like rifampin, St. John's wort, that are enzyme inducers too. So not a total catch-all, but definitely something to think about. If you know a patient has a history of seizures, you might want to double-check drug interaction screen if you're going to put them on oral contraceptives or if they're taking it there. All right, well, I think that's going to wrap up the podcast for today. Hope you picked up some clinical practice pearls. Questions, comments, reach out to me, mededucation101@gmail.com, or you can find me on LinkedIn as well. Also, remember to support the sponsor today, pearls.com/RLP. Go get your free table, free resource on all the different types of oral contraceptive products. Great layout that they have there. You can categorize them, sort them a little bit. Nice little resource to have. You can do that simply by doing a free account at pearls.com/RLP. If you enjoyed this episode, leave a rating review on iTunes or wherever you're listening. That's greatly appreciated. Track me down by email like I mentioned before there. And I'm going to sign off for today. Thank you so much for listening.
Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com.
No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.